My name is Jared Keogh, and I'm a Senior Program Officer here in the Innovations for the Underserved program here in the Foundation. We want to get things started. So let me give you a little bit of a background of what we're doing today and sort of the Innovations for the Underserved program. Innovations for the Underserved program's goal really is to reduce barriers to efficient, affordable healthcare for the underserved. We do this by supporting technologies, vendors, or entrepreneurs who are improving access to care, lowering the cost of care, and or improving the efficiency of community health centers. Our work is informed by feedback we get from clinicians, health IT staff, providers, and patients. And so your feedback on an ongoing basis is critical to ensuring that we are supporting sort of the right type of opportunities and technologies. The goal of today's webinar will be to showcase a very exciting solution for streamlining the front office and improving both patient and provider experience. Before I hand over the controls to Chris Connor at SMS, the Seamless Medical Systems, I wanted to go over a few housekeeping items. One is this presentation will be recorded and posted online so that those who couldn't join us can access and view it. Your lines will be muted, but please feel free to type in questions in the chat box. And in order to do so, make sure you click on the chat button and select Send to All Participants and post any questions. Both Canal and I will be monitoring those questions, and we'll be sure to get them answered. And also, lastly, if you have any questions, particularly any technical issues, please email Canal, and you'll see your email address up on the screen. So once again, thank you for attending, viewing this presentation and product demo, and please, be engaged and ask questions, and we'll be happy to answer them. With that said, I'll go ahead and pass the presentation ball over to Chris.
Hey, Jared, thank you. Let me go ahead and get my screen selected here. And Jared, can you see the right presentation?
I still see my actual presentation.
Okay. I apologize. Where is your switch on showing the screen?
Do you see the share menu at the top of the screen? There you go.
Yeah, I think we see something coming in right now. Okay. We see your screen.
And do you see just the presentation?
I think we see the other side of your screen, so that looks like it's the desktop.
Okay. Let me pull that down here. All right.
Yep, we see the presentation now.
Okay. I apologize for that. So first of all, thank you, everybody, for the opportunity to show you a little bit about what our solution provides. It's an exciting opportunity and exciting relationship with CHCF, and we'll have an opportunity for questions and answers at the end. And again, as Jared said, in the conversation box, please indicate any questions you might have in a chat session so we can address those as we go forward. A couple things, I think one of the important things to kind of point out as we talk about this is that from a very start with our solution, we offer integration from everything that we do into your EHRs in a real-time format. All of the data we provide is discrete data, and I'm going to show you how those data formats are laid out. But I want to set the stage here that talks about the fact that as you're working with our solution, we can integrate into your EHR solutions. That data flows back and forth seamlessly on a real-time format. And you can see some of the type of data over on the left-hand side that we allow. The data formats and data integration we provide is really limited only by the ability of the individual EHRs to actually accept that data. So I want to have you keep that in mind as we talk about this, and we'll probably go back to this a couple different times throughout the presentation. So as you look at your clinics, most of the time the typical intake that your clinics are presented with when you have a new patient walk in the office or a returning patient is they're provided with a set of information that is really on paper and really not terribly efficient for your patients. It is generally quite hard to read, intimidating, and it's very static. When you put things on paper, you have to print out a bunch of them. They can't really ask questions or more data. You'll see how that works. And then there's always a pretty significant cost to those, not only from the production, the design, the print, but also when you look at what happens after the patient is done, and that is all of the data that needs to be entered, all of the forms that need to be scanned and attached, and then all of the costs related to shredding and or storage of those documents. So what do we do that is different? We actually provide a digital format of that same intake data on the iPad. And you'll notice that we actually make it much more simple to read, and I think that helps in a number of areas. When you look at patients coming into the office, they want to be able to tell you what you need to know, but they want to be able to do it as easily as possible and as quickly as possible. And so our forms are designed to be very simple and easy to read. They include the ability to have dynamic content. So as an example, if you ask a question that says, do I have diabetes? And the patient says yes, then we'll ask more questions, where in a paper format it's very difficult to accommodate for that kind of depth. So it allows you to be very dynamic in the type of questions and responses and then digging for more data when you get a certain kind of response. We also pre-populate the forms. I think everybody has had the opportunity to go into a clinic that you've been in before and had to fill out the same paperwork again. And we eliminate that challenge as well, which really helps your patients in their speed of intake and in their compliance. And so it makes a big difference from the patient's perspective when they're filling out paperwork and just simply updating limited information instead of giving you data that you should really already know. It increases the compliance of the patients in a number of other areas. When you look at what happens many times on the intake process, patients are forced to answer the same kind of questions or put in demographic data across the top of a form multiple times. And by the time they get through the fourth or fifth page, they become very despondent and very reluctant to fill out more and more paperwork. And so this really helps them ask and answer fewer questions and respond to those questions more completely than you had in the past. And I think the thing that's really important to note, again, back to the integration that I started out with, all of the data that comes off of these forms is automatically entered. So it's updated into your databases in a real-time format, thereby freeing your front desk staff from that administrative task and burden of data entry, eliminating all of the data scanning and attaching to the patient records, which does a few things. One, most importantly, is it secures the documents and eliminates all of the shredding paper costs, but it also, as importantly, attaches those documents into the patient's record. So your MAs and providers have that data that the patient filled out every time they see the patient, and no longer are they asking questions in the exam room the patient just responded to in the waiting room. We're also multilingual, so it allows for the patient to answer the responded questions in a language format that's most comfortable for them. We support natively Spanish and English, but we also have an ability to implement other languages into the architecture. And you can see you do that simply by a touch on the screen. One of the other things that's very, very important is kind of the compliance around policies and consents. And one of the things we do is also offer the ability to put in any of your policies, whether it be HIPAA privacy policy, your financial policy, forms, consents, no-show policies, those types of things, where there's usually maybe a different color of paper that's stuck on the clipboard today. And what typically happens is that your staff has to look around the first of the year to see if a patient has signed their document in the last year, or what most practices do is they'll say, anybody coming in January, February, and March, you just have to fill them out no matter what. And so one of the things we can do is actually help you with that process to make sure that when a financial policy or HIPAA privacy policy needs to be signed every year, we know if it's been 11 months since the last signature for that patient, and we can insert it into the workflow automatically and really help keep that compliance up to date for all of those forms and documents for your patients. Not only does the tool allow for flexible intake options as far as questions and answers, but it also allows for anatomical form input as well, which is very, very friendly for your patients. It allows them on any wireframe body or body part to indicate what's going on, multiple different areas, and actually describe their pain or issue right there on an object that goes into the provider's EHR as an attached PDF. So the providers can always see what the patient is describing, and again, those documents are always immediately attached to the patient's record when they walk back in the room. We also have a very large library of forms and assessments. One of the assessments we have in place is the PHQ-9. It actually starts out as a PHQ-2, and based on the responded scores, generates and rolls over to the PHQ-9 to ask more questions. And part of our commitment for the market is to actually embed all of those standard assessments into the library so that you can administer those assessments to your patients as necessary, and again, have those scored and attached into the patient's record dynamically and automatically. Another important part and aspect of the intake process is kind of helping your front desk staff not have to be, if you would, the bad guy. So one of the things we do with that is actually integrate the payment process as well. This allows us to interrogate your practice management system, understand what the copay and or existing balance is, present those on the iPad, and offer the patient an ability to pay those service fees right there on the iPad with their credit card and or their debit card, and then have those post automatically back into your system. This really helps with the comfort level of your staff and your patients and makes the iPad the person asking for the payment instead of your front desk staff. Now, we also offer mobile access for this. So for those situations where you want to have the patients have access to a mobile environment, we do make that available. And those same forms that you saw on the previous screens are also available on an appointment type basis on your mobile device for your patients. This allows them to answer and fill out those questionnaires at home before they ever get into your clinics. Now, we don't stop with just the intake process. We think that intake process is extremely important. It provides tremendous value for your clinics as far as workflow efficiencies and other workflows in the organization. But most importantly, it also allows your patients to be engaged in your clinic, and we do this with our personalized health magazine. We call this My Health, and the magazine is really geared toward making sure that your patients have relevant, personalized health education information available to them while they're sitting in the waiting room. And it's really geared on their age and their gender and their health condition. We get the content from a number of different sources, such as the Mayo Clinic, National Institutes of Health, Prevention Magazine, and we really try to package the content so that anybody can read that content. Our objective is really to engage the patient in their health education rather than try to overwhelm them with too complex of content. It really is designed to help kind of make the content you typically stick in brochures in the waiting room or stick as table tents in the exam rooms. It makes that much more consumable for the patients. We make it very graphically engaging. And the patients can also subscribe to this at home. And I think the thing you'll notice, it's branded by your clinic. That's your clinic name at the top, and then also allows for your patient name. So even if your patients are not coming back in, they can subscribe to this for free. It's sent to them at home, and it allows you an opportunity to put your name and put this content in your patient's hands on a regular basis, at least every quarter. And it's, again, branded by the practice, which is, I think is important to kind of keep the patients reminded that they need to be coming back into you for their health checks and back into your clinics to keep themselves as healthy as possible. One other aspect of the magazine is the ability for your facility to actually communicate and educate your patients on other products and services that you're offering. It is a very difficult challenge for facilities to actually help educate their patients about any new products or services they might have or existing products that haven't been well promoted. So it could be as simple as, you know, you're doing a flu shot the last 3 weeks in November or something like that, or you have a new DEXA machine. Even the announcement of a new provider location, this marketing tab within the My Health magazine allows you, while the patient is in the waiting room and also at home, to see the new products and services you have to, again, keep them engaged and bring them back into your clinics. It's very important for us to have crucial and key partners, people like California Healthcare Foundation and the Kresge Foundation. And those organizations have really evaluated the market and shown their trust by working with us to help, again, push simple, effective technologies into the FQHC market. And we also have a very important partner in Shasta Community Health. They are partnering with us in the implementation of our technology in their facilities, rolling it out to all of their centers, and really helping to streamline some of their intake processes and make an impact on their patient satisfaction. We are actively looking for other pilot partners that we can work with both eClinical, GE, and other known FQHC product partners. So if you are a facility that is interested in working with us and CHCF and Kresge on a pilot in the same manner, we would be very, very interested in talking to you and seeing if we can assist in that endeavor. As an overview, our platform provides access and communication and touch points through the patient all along the way. So the patients can see and access information at home through the search and schedule capabilities. They can update their demographic and history information from home in their bathrobe if they need to. And then when the patient walks in your clinic, we allow at the point of care the patient to actually fill out their intake documentation as you saw, pay their bill right there online or right there on the iPad, and then be further educated with the My Health magazine related to their gender, their age, and their health condition. And again, that content is available to the patient at home, on their mobile device and on their PC, and this allows you to continually communicate to your patient throughout their journey and throughout their life cycle with you. Some of the key elements that we provide for the facility that I think really makes a difference in patient care and in your facility's overall operations, the workflow efficiency is significant, especially when you look at your front desk and your MAs. That data is being collected on the iPad. It is being integrated directly back into your EHR and your PM system. So the data entry is eliminated from your staff perspective and allows your staff to take better care of your patients, both at the front desk from a patient service and in the back office in a patient safety standpoint, where they're really asking the patients more depth rather than being focused on the data entry. Tremendous reduction in cost and waste. The amount of paper, the amount of toner, the amount of just wasted staff time is extraordinary in the facilities. And I think the improvement on the data quality can not only impact the satisfaction of the patients, it can improve the billing process to make sure that data is going out properly the first time, and it just makes a big impact for patients when they know their name is spelled right and everything is correct in their medical record. Patient satisfaction is a key as healthcare has migrated over the last several years, and really putting a tool like this in the hands of your patients that allows them to have some control and some easy access to putting in their data really makes a change in their perception of your clinic, and it allows them to actually tell other patients and other people about the experience they've had in your facility, including the good experiences, which is very positive. And I think our platform does a tremendous job of setting the foundation for enabling patient communication through the My Health magazine, and it really changes the perception of your facility in your organization. So as an end, if you're still struggling and putting paper on clipboards and handing those clipboards to your patients, we would love to talk to you. We think the partnership of Kresge and the California Healthcare Foundation can really help make an impact in your facility and in your workflow, and offer a great opportunity for you to make a change in the overall efficiency of your organization. I will leave it open for questions now.
We got one question here, Chris, and this is from April Howard. Question is, in addition to the THQ-9, can a provider load other outcome measures? For example, back depression inventory into the system for our clients to complete at intake and at other point of services?
That's a great question, April, and yes, absolutely. We don't have that whole library formed. As you know, we're still a relatively new company, so there are a number of different screening forms and questionnaires out there. All of those that are kind of a standard form, we would love to work with you, get those put in, create the scoring, and we would include that as part of your implementation.
Chris, that's all the questions we have for now. So if you would like, can move on. Oh, actually, we got another one here from Cheryl Johnson. Do you have access to SBIRT questionnaires?
We do not that I am aware of. And again, kind of the same answer with the other one, we would be more than happy to work with you on implementing those forms into the architecture and making those a standard part of the library.
And another question from Cheryl, follow-up, is would you consider another next-gen partner?
We would, absolutely.
Great.
Yeah, I think, you know, as we get into this market and really begin to penetrate the F2HC market, we would really like to have 2 or 3 really solid partners for all of the core EHR vendors that are in the F2HC space. And so, you know, I think for us, even though it's the same EHR, the implementation is going to be different, the patient population is going to be different, the challenges are going to be different, but I think the outcomes and kind of the way that we can work with you to generate a better patient experience, you know, we're excited about those opportunities, and certainly 2 or 3 of each vendor in a pilot phase would be very interesting for us.
Good. I think what would make sense is after this is to connect you and Cheryl Johnson and you guys can have a discussion around this.
Yeah, absolutely. All of my contact information you can see on the screen there, so if you want to send me an email or give me a direct phone call, I'm usually pretty nice, so I'd be happy to take your call.
So follow-up from Cheryl is regarding the pricing of something like this.
So pricing we would talk offline, but we do have a significant reduction in the pricing in the pilot phases by virtue of the relationship with CRESTI and CHCF. And so it's a very, very limited risk in the pilot phase to kind of prove ourselves to your organization.
Great. And a question from Shaheen is regarding where does the data live?
So the data lives in 2 places. Primarily, the data lives within your EHR and your practice management system. That's the source of data for us. Everything that we do, we get that data from your EHR and practice management systems. We also, though, keep a copy of that data in our HIPAA-compliant SaaS-based database in our environment, which allows us to use that data both from a speed standpoint and validation standpoint, but also it gives us an opportunity to provide that data to you both statistically, not only for the intake data, but also all of the magazine data. So as patients are reading through the magazine and looking at different articles, we can also provide to you what type of articles are most interesting for your patients, how much time they're spending in those articles that might help you think about different product offerings and services to give back to your patients based on how important those articles or how interesting those articles are to your patient.
Okay, Chris, I don't see any questions coming in now, so now might be a good time to transition over to the demo.
Okay. So what I'll do, I'm going to do a couple quick setup things here. And I think the thing that that will be most important is to understand that this is a demo environment, and I'm going to do it, from scratch for you just so you can see exactly what that looks like. So one of the things we provide for our users, let me get this down here on the screen where it'll stay in there, is we provide an ability for the facilities to actually use the database and customize by appointment type the forms that they're going to use. And so each appointment type that your patients have, those appointment types are going to dictate the exact intake forms your patients will have. And I'm going to show you an example of what that looks like. One of the things we do is we read from your patient schedule, and that patient schedule is going to provide us the list of the patients coming in. So what I'm doing here, this is kind of a shortcut for us, but I wanted to give you an example of kind of what those forms look like. When you set this up with our implementation staff, they will decide with you exactly what's going to show up within each appointment type. So as an example, you may have one that is just registration, some history, review of systems, those kind of things, and then some of your signature documents. And then those will actually show up on the schedule. So you have a dashboard that is going to be used by your staff. That dashboard is a tool that allows for a couple different things. One is every time that your patient is using the iPad, you can see when that iPad's been checked out and when that iPad is checked back in. Each iPad is individually identified, and the iPads themselves are completely locked down to do only what we allow them to do. And so the patients aren't going to be able to go check their Facebook status or do anything else in their endeavors. They're going to be locked out to do exactly what we tell them they can do. And I think what that does is that helps kind of alleviate some of the issues and concerns about the iPads walking out the door. And it also helps make sure that your patients are focused on what they're supposed to be doing in your facilities as opposed to playing any games. But it gives you an opportunity to have the iPads really be your front desk and be your greeting, and I'll show you a couple ways that looks. The other thing the desktop does is you've also got a button here called Call to Service. This allows you, in the middle of the patient having the iPad in their hands, to actually call the patient back for service or maybe to the front desk for a question, potentially call them back to the lab to get their blood drawn. So you've got a number of different options in how you can use that Call to Service button that allows you to communicate to the patient in a real-time format. Now, I'm going to actually go ahead and emulate my iPad onto the screen, and you'll see what the interface looks like for your patients, and I'm going to pretend to be a patient. So can everybody see that iPad okay?
Yep.
Okay. So normally there's going to be several different patients on the screen, and the iPad is now sitting in the hands of your front desk staff. So no other patients are going to see any other patient data. The iPad is sitting in the front desk staff's hand, and the patient is going to come up and identify herself, and she says, "Hi, I'm Jane, here for my appointment with Dr. Alvarez." So at this point, you'll touch on Jane's name as the front desk, and then at this point, I'm going to turn and hand the iPad to the patient. Now, the screen you're seeing here can be completely customized as well to your clinic, so it can say, "Welcome to our clinic," put a picture in there and make it very nice and pretty, but it allows you to kind of initiate that communication to your patients right from the get-go. They'll touch on the Start button, and then it'll go into the patient intake process. So this is a patient that is a new patient to the clinic. She's called ahead and booked an appointment time that we read, and your staff collected minimal information on who the patient is. So we got first name, last name, sex, date of birth, a couple other key elements. So the patient's going to go ahead and fill out the rest of the data here. So she's going to say she's a married lady. Touch on next. She'll go ahead and put in her address. And the thing you'll notice is this, as you go through this, is that the look and feel is very, very simple. And I'm just going to put in some data and show you how good I am at putting in data. It's always fun. Actually, I should put in another digit here on the zip code, I guess. You'll notice that it's actually prompting me, and that's a very good thing. You can have it prompt you if data is not correct and or if the information isn't accurate. So you notice when I put in the zip code, I had put in a different city and state, and it corrected me. So this is the actual correct city for that zip code. Put in a phone number, and then other things. So at this point, if I were to go next, what's going to happen is the iPad will tell the patient, I know you're ready to go forward, but we still need a couple more things from you. So at this point, the patient will come back here and say, you know what, you need to call me on my home, and you can leave a private message on my home phone, okay? Any of these fields, you can determine what need to be required or not, what needs to be there or not. So that's part of the implementation. We work with you extensively to make sure that the data you're gathering from your patients is exactly what you need, and we'll push that directly again back into your practice management EHR system. Some of the other forms, so here's one asking for their pharmacy. These can be things that can be defaulted in here. They can tap those in, type those in, primary care physician, other information. Again, sometimes it's a little bit difficult for a patient if they're a little concerned about providing some of this data, so they can come in and put in their decline to respond and ethnicity and how did you hear about us? Well, from my insurance company. So again, just some examples of data that you can ask for your patients. Emergency contacts, so we'll say that it's Bob, that's her spouse, and we can put in Bob's phone number. And then other options. So again, here's a chief complaint. You know, again, it's a new visit. She's just coming in. Maybe she took a quick thing, but she wants to type in a little bit more. Again, that can be a list. That can be just a type in. You can really determine what those are. How the forms behave also is completely controlled by you. Remember when I started talking, we talked about dynamic content and ability to have the form kind of be intelligent behind the scenes. Here's a good example of that. If I push no on each one of these things, as a patient I could go forward. But notice if I say yes to diabetes, that it actually then says, oh, that's information that's very important to us. Tell us more. Well, I check my blood sugar on a regular basis. I check my feet once a week. I've had nutrition counseling. I have no numbness, and I have an advanced directive. So again, depending on the question, the fact that you're using a very simple tool like this allows you to gather more data, more comprehensive data, and makes the intake process more valuable for you and much more simple for your patients. Again, past medical history, and I'll go through a few of these. You can actually default no on these if you wish, or you can have it be something your patients can just skip over, entirely up to you. Again, different types of questions on what you want to have, but these can be very short or very in-depth depending on your implementation. As a female question, as a female that's doing the registration here, because I put myself in as a female, it's asking me female questions. If I'm a male, I'm not going to be asked these questions. So it makes it very simple to make sure that these are coming up properly. Do you have any reaction to anesthesia? No. Have you had surgeries? Yes. Okay, tell me about it. No. Okay, I don't need to know anymore. So you can see even if I say yes, I come in here and I say I had an ACL repair, you can also have it, well, you know what, tell me what date that is. So just some nice options in making the intake as easy and simple as possible. Same thing on things like family history. Again, some options. You kind of get the idea. These can be very in-depth, ask as many questions as you want to, and it's very, very comprehensive in the intake for you. Some of the other things, if your primary care tracking for meetings to use or any of those kind of things, you understand these questions are part of that process. You're using tobacco products? No. If I say yes, and it says, well, tell me a little bit more about it. Same thing on the alcohol. Yes, I drink. I'm an excessive drinker, and I have 4 more caffeine a day, and I never wear sunscreen. Some of the other things, seat belts, never. No transfusions, not employed. And I have 8 or more children that I know of. Primary care, some of the other things, so different forms. Also, things like assignment of benefits. So here are those copy-paste forms with the signatures. So your patients have an ability to actually sign the form right there on the iPad. We apply that signature to the document. And these can be as many as you want, as repetitive as you need them to be. The nice thing, again, these are one of those things that if it is a 1-year policy on each one, we can track the date that those have been last signed and present those as necessary. There's a release of information, authorized release of information. We forgot to fill out a form. So again, you can see Bob's name there again. Another release, we'll sign that one. Financial policy, we'll make the signature different so you know it's working the right way. And at that point, when the patient's done, again, rather than have the patient actually go pick up a magazine and have to turn the device back in or anything else, this is where you've got an opportunity to have the content that's loaded on the iPad really be dynamic and specific to that patient and that patient's health condition, age, and their gender. So here you see it's a female, very attractive looking covers, different articles on here. There's a table of contents they can click on up here in the corner and look at the table of contents, or on any of these articles, simply touch one button and go right to the article within the magazine. Okay, so they can just thumb through here, and again, they can subscribe to this at home. It's branded by the facilities, and then they can go to the next article just by navigating as well. So a number of different options. There's always some recipes and different things in here, so it's kind of fun. And I think the thing that we find that's very interesting for our patients is that almost every patient spends between 10 and 12 minutes in this content every visit. So we make the content engaging, we mix up the content a little bit every quarter, we make sure that the patients have something they can actually engage with that's beneficial to the patient and beneficial to you in your intake process. So one of the nice things here is when the patient's done, they'll hand the iPad back up to the front desk. Front desk will simply go through here and reset the iPad. And you notice when I got into the patient's data, the patient wasn't able to go backwards. She could, you know, and go look at that list of patients again. And at this point, when the front desk resets the iPad, that's the only time that the other patient names would show back up on the iPad. So right now, it's back in the hands of the front desk. So that gives you a taste and a flavor of kind of how a patient would interact with the solution. Any questions that have arisen so far?
Yes, Chris, Cheyenne actually has a few questions. Canal, would you mind unmuting her, please?
Hi, we have a number of questions at Open Door here. We got a whole table full of folks.
Great.
And some of this is pretty exciting. Have you ever worked with Epic?
We are actually talking to Epic in about 3 different situations, but we have not done the implementation or integration with Epic to date. We would be, just like the pilot program on the other ones, excited to do that with a facility that's using Epic.
So one of our issues is, where does the data live?
So the data lives in Epic, and data lives in our SaaS-based HIPAA-compliant architecture up in the Amazon cloud.
And everything is encrypted in such a way that…
Absolutely. Yeah, absolutely. We actually, so part of our work in the Amazon cloud and why we chose them is that they're the most secure healthcare cloud environment in the country. And we actually pay quite a bit extra to make sure that our data is secured in that environment. And we do quite a few other things from a data security standpoint as well. And screen by screen, as you were seeing me flip screens, the data is off the iPad and in our cloud. And as soon as it's switched over to the magazine, that's when we push all the data down to Epic or to the EHR to do the integration.
Jerry, did you have?
So the iPads in the waiting room obviously need internet access then. It can't just be clinic local access. It has to be able to go to the Amazon cloud?
Correct.
And do you know
But they don't go anywhere else.
So if a patient's using their own device at home, are they going to a website or are they going to an application?
They're going to an application, and they're authenticated inside that application.
But is that application only available for Apple or is it Android?
So that's a very good question. So in the office, we are 100% Apple because of the security the iPads provide from a number of different aspects. At home, it's both Android and Apple and desktop PC if necessary.
And do you happen to know what kind of authentication you're using? Are you using OAuth or?
Couldn't tell you that, but I'd be happy to find out.
Is the content of the questions, the order of the questions, the skip patterns of the questions completely customizable?
100%. Yeah, and that's So that part of it, sorry, I was writing something down. So that part of it in the implementation is probably the part that takes the most time because it really changes the dynamic. Typically what you see is front desk kind of know the order of papers that go on the clipboard. This makes you think a little bit more, and it's a lot more dynamic. And what we find happens oftentimes is we get into an organization and it becomes a good opportunity for them to kind of review and revise some of the intake questions that they no longer need and add some of the ones they do need, and it really helps kind of drive the right kind of workflow and right kind of behavior because those forms are coming up in the right order for your patients.
So I just wanted to hear just a little bit more about the pricing. You did a pretty good job of letting folks know that as long as they're part of the original with your partners, it would be less. But you never did give us any idea of what the cost is. Yeah,
and I typically don't like to give too much pricing detail in a more public forum like this. What I can tell you is from a structure standpoint, the upfront is very, very minimal, and there's a subscription fee on a per provider, per FTE provider basis that covers all of your other costs.
So it's structured by FTE providers, not by patient numbers?
Correct. Yeah, and we know, especially with your market, you have a lot of times where you've got, you know, a provider that comes in maybe 2 days a week, maybe even 2 days a month. So we really look to you to say, yeah, we may have 45 doctors that provide care in our facilities, but truly the count of FTE providers is 27. We trust you. We trust that number is accurate, and that's the number that we go with. If you have 55 and you tell us there's one provider, we might have another conversation, but.
And how do you handle multiple sites? Like if you're not just one clinic, but you're a dozen clinics?
Yeah, almost all of our implementations are exactly that way. So as an example, one of our largest implementations is Target clinics. They're not an FQHC, but they have 85 different sites, different locations. So they more or less standardize some of their forms, but we can also allow for modification of forms by location as well.
And that was going to be my next question, because some of them are just dental only. They wouldn't be medical.
Right, right. Yeah, that's more the norm than a single site location for us.
What's the tie to banking? If we're going to be able to take payments through here, do we need additional software, or you know, what's the interface?
You know, we work with a couple different vendors, and generally we work through the vendor, and they run kind of the merchant accounts. But a couple of our vendors also are agnostic to merchant accounts, so that would be something that we could have that conversation. It's really an infrastructure that we provide, and then we can kind of plug and play merchant accounts and capabilities under the covers.
Thank you.
You bet.
Thank you. I think those are our questions.
Those are great questions. Be happy to you know, go through any specific details with you one-on-one as well.
Thank you.
Yeah, that'd be helpful, Chris, if you can pull up your contact information. There you go. Thank you. So we have another question here from Cheryl Johnson at Sonoma Valley Community Health Center. And I'll read this one out aloud. Question is all the information is all the information transferred structured data in NextGen? And does it become part of today's progress note?
Yeah, so that's a great question, and part of what we're doing right now with Shasta is determining with them, sorry, I just jumped too far past it, is determining with them exactly what data they want as structured. But in the beginning, all of our data is discrete data, and then it really becomes a limitation of either implementation time frame or the individual EHR on what data is going to come in as structured. But our objective is to push as much data, if not all of the data, to NextGen and have NextGen consume it as structured data. And it will show up, when you think about the clinical data, it will show up in today's note, just as if an MA had put it in there and then set the visit on hold. It's a great question, because I think that's one of the aspects that really adds that significant value. I know when I walk in, I don't like the fact that my MA or doctor has to kind of turn their head to me and start putting in the data. And the more time they spend looking at me and interacting with me, I feel better about the visit. And I think what this does is it provides an ability to get as much of that discrete, maybe not critical data for today's visit, but also including today's critical information, to get that in as discrete data so that the MA is really focusing their time and effort on what is going wrong instead of how do I put this in. Love that question. Any other questions?
So it looks like we are all out of questions right now. So let me just thank everyone for being so engaged and asking all those great questions. You know, and
great question.
You know, yeah, certainly, and it was very productive. And you know, we're always, you know, collectively looking for feedback on the value for a tool like Streamless Medical Systems, and also, you know, as Chris mentioned, additional pilot sites, right? And so we'd certainly love to hear the audience, you know, thoughts and interests on either of these topics, and you know, happy to schedule a follow-up. You can reach me there. Let me pull up the screen here. Chris, if you can pass me the presenter ball, I'll pull up my email address so people can follow up.
Let me find that. How do I do that?
It's right next to your name to the left. It's right by the phone icon. If you just drag that ball and drop it on my name. Oh, thank you.
There we are. Okay. Okay.
So yeah, and so you should see my email up there. So any feedback and follow-up discussions, you know, please reach out to me at jto@chcf.org or directly to Chris. With that, I'm going to go ahead and, oh, actually, no, you know what? We got one. So there's one question that came in. Cheryl Johnson. So let's see. Can the medical assistant be the one to call to service?
I'm sorry. Say that again.
The question is, can the medical assistant be the one to call to service?
Yeah, absolutely. So the dashboard is really for the clinic, and that's really kind of a workflow thing that you would work out within your clinic. But as long as that medical assistant has access to the dashboard, she can do that at any time, she or he.
Great. Thanks a lot, Chris, for that last question. And I'm going to go ahead and wrap it up. But you know, please, once again, if you have any follow-up questions or just want any, you know, just want further discussion, please reach out to Chris or me over at CHCF. Thank you, everyone.
Thank you very much. Have a good afternoon.